More than 35 million people are discharged from U.S. hospitals each and every year, but millions end up right back because of medication errors or other mistakes that can happen at home. And that was the case for our own Lisa Fernandez, who works on our show.
When I was in high school, I was hospitalized with severe asthma and pneumonia, and my mother was with me by my side the entire time. When I was sent home, she was so exhausted from caring for me. She accidentally gave me too much of one of my medications. I got violently ill, ended up back in the hospital. Needless to say, it was a really traumatic experience for both of us. A good friend is going in for a procedure soon, and I would love to offer my help when they come home, but I'm afraid of the responsibility. I could use some advice when it comes to this.
When you leave the hospital, complications can certainly occur. Lisa's story is just one example of what can go wrong. So we invited back Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, to help families prepare for bringing a patient home after a hospital stay. Such an important topic.
It's really important because planning for discharge from the hospital is really an essential part of overall treatment. And a good plan can actually help do a number of things. It can help speed recovery and can reduce the risk that the patient is going to end up back in the hospital. Studies have shown us that about 27% of hospital readmissions were avoidable. They happened, like for Lisa, as a result of medication errors. They happened because people missed their follow-up medical appointments. And in some cases, it was the lack of planning for the transition of the patient to the home. And that can lead to complications like infection or accidental falls.
So let's talk about 4 important steps to take before you or your loved one leaves the hospital. First up, it's important to fully understand your doctor's discharge instructions. When it's time to leave that hospital, most people are ready to go. That's understandable. But that's the time to pay such careful attention to next steps.
Absolutely. There is so much information you're going to get. Medications to take, schedules for follow-up medical appointments, instructions for how to care for surgical wounds. Don't be embarrassed to ask questions. Ask for it in writing so that you have it to refer to later. And you can put your technology to work as well. Ask if it's okay to record when you're getting the instructions. That way you can play them back later. And also to ask about dietary restrictions. What can I do? And also, what can I do? Sometimes people don't ask that question. As well as what to look for to know if there's signs of trouble. Is there a fever? Are there other signs of infection? And really importantly is what you should do if you see any of those signs.
If you're a caregiver, you need to find out if you will need to give injections, if so, how to do it, or if maybe your house is going to need special equipment. Maybe you need a shower chair, raised toilet seat, bed rails, or even in some cases a hospital bed. Next, work to have the recovery space ready before the patient leaves the hospital and comes back home.
Make sure that that area is clean and clear of tripping hazards. Get rid of TV cables, electrical cords, loose rugs, those kinds of things. And also, supplies are important. If you know you're going to need supplies, have them at home when you get there. And if you're going to need extra help, see if you can have that help in place and ready to go when you get home.
And some studies have actually shown that as many as 40% of patients over 65 had medication errors after they left the hospital. You can avoid this by making a list when all medications must be taken, how much should be taken, also for how long it should be taken. Then cross-check that with the doctor or nursing staff before you leave the hospital.
You also want to know answers to questions like, do your prescription and non-prescription medications interact with each other, as well as how they interact with food or liquids. And your doctor or your pharmacist can help advise you on that and make sure that all of that is sorted out.
Last but not least, know what to do in case of an emergency. Make that emergency contact list, including contact information for your healthcare team as well as friends and family members, and keep it where everyone can find it easily. But in a true emergency, we always know, call 911.
Absolutely. Both the patient and the caregiver should seek out support and companionship during the hospitalization, but also during that recovery time at home. go ahead. Don't be afraid to ask for help during this critical time. And this is a lot to remember and a lot to know. So for more information, you can go to gethealthystayhealthy.com. And we tried to put some of these together in a checklist that you can download when you get there. And also when you're there, you can sign up for the monthly newsletter.
Well, thank you so very much, Dr. Freda.
Thank you.
We appreciate you joining us. More to come, everyone.